All right, we're back with our Medicare and Affordable Care Act experts, Catherine Sevier with AARP North Carolina, Laura Packard with Get America Covered, Steve Edmonds from Alliance Insurance Services. All right, Steve, I think this question is for you. It says, do all Tier 3 drugs have a deductible no matter what drug plan you choose?
They do not. And again, this is a complicated question. A lot of your Medicare Advantage plans, which are also referred to as Part C plans, many of those do not have deductibles on Tier 3 medications. However, if you're on a Medigap policy, which is an older type of coverage that's been around for years, but it's a really good coverage, but most people on those plans have a standalone drug plan. And with the standalone drug plan, it is very common to have a deductible for a Tier 3 drug.
Okay.
So it's according to which plan you're on. You know, it could be a yes or a no. It's according to your plan.
Catherine, this person says, I have Medicare and Tricare for life. Do I need Part D or anything else?
No, Tricare for life actually stands in as your Part D and your supplement. So once you have Medicare for life, Tricare for life, it is for life, and it stands as a supplement as long as you're in conventional Medicare or standard Medicare.
All right, Laura, this person is following up on a question. I think we'll answer it for both ACA and Medicare, but for ACA, it says, if I stay enrolled with what I have and I don't make any changes, does it just re-enroll me automatically? Oh, I think Laura's frozen on the bus. Okay, so when it comes to ACA and Medicare, I'm sure, Steve, you can answer this question as well.
Okay, so let's take Medicare first. Your Medicare plan will automatically roll over. So if you're satisfied with it, you're loving the plan, and you don't need to make any changes, it will automatically roll over, no problem. So yes, it will. On ACA, that is more complicated because it will automatically roll over, or it should. But there are so many things that need updating on those plans, like, has your income changed? Has your household income or dependent status changed? Did you get married? Did you change jobs? A lot of stuff needs to be reassessed from year to year on an ACA plan. So I would recommend always doing an update on that.
Okay. All right, like this person is asking, which company has a benefit to pay for in-home custodial care for the elderly? Catherine?
Most health insurance plans do not have benefits that pay for that. There are some opportunities when you're in a Medicare Part C, through a Medicare Part C or an Advantage plan, they may have relationships with hospice and palliative care programs that they will help support. The one exception to that is if you are what we call a dual eligible person who has Medicare and Medicaid. There are some benefits provided there, but you have to talk with your provider to get yourself hooked up with those. They don't just automatically happen. They happen because your provider makes the appropriate referral.
Okay. Let's talk about dental benefits and Medicare now, because they're paying more for dental benefits. Is that what's happening this year, Steve?
Yes, a lot of your Part C plans, which are the Medicare Advantage plans, a lot of those give really good dental benefits. It's common to see like a $1,000 a year limit there that you can spend for dental. Some have as much as $1,500. Some have $2,000. So it's some really wonderful dental benefits under the Medicare Advantage plans. Now, some people, as we referenced a while ago, do have the Medigap plans with a standalone prescription drug plan. Now, on those type plans, there is no dental, no vision, no hearing, and no over-the-counter drug coverage with the older traditional plans. But on Med Advantage plans, yes, it's wonderful wonderful dental coverage on those.
Okay, and you do have to ask your dentist if they are accepting Medicare. You're nodding yes, right, Catherine?
Correct.
Okay.
Right.
Okay, just like everything else, they may not take that insurance, just like they don't take your private insurance, that kind of thing. Okay, so this person
True.
says, I'm still employed with insurance through my employer. I did sign up for Part A at 65. I'm over 70. Does Part A cover what insurance did not?
No, it doesn't. Part A is your hospital plan. Part B, which you didn't, it sounds like you didn't sign up for, is the one that covers all of the things that happen to you on an outpatient basis. So I would assume that your employer-based insurance is picking up those costs like they would as a primary insurer, but you could still have a deductible and probably will.
Okay, and just quickly, they need to sign up for Part B, but they're already going to be paying the penalty.
They won't be paying a penalty if their group coverage was, if it's the acceptable coverage. Usually employers that employ 20 or more people would have an acceptable plan, but you always really need to check that out. But
Okay.
if this person, if they're age 70, when they do retire, they really need to tap into that Part B quick, within 30 to 60 days.
Okay, once you retire, you have to tap into Part B 30, 60 days. All right, we're going to take a quick break. We're continuing to take your text questions next. We're going to take a quick break and look at the forecast for the weekend.